So let me show you some case examples now that sort of span the gamut of my practice. The elective ventral hernia repair, this is sort of my bread and butter, a very large ventral hernia. This is a lady, late 60s, colon cancer, status post low anterior resection, metastatic to the liver, status post a partial hepatectomy. You can see both those incisions. She also had metastasis to her lungs and had a thoracotomy. She's no evidence of disease, but living with this large hernia. Because these are all cancer patients, they all get pre- and post-operative CT imaging for surveillance. And we had a speaker earlier today asking if this was necessary. In my practice, I do find it's necessary. It helps me to plan the surgery, and it helps me to know if my repair is still intact over time. So this is just part of her pre-operative CT. You can see she has herniation of her liver with a big myeloma. You can see she has herniation of the large and small bowel in a supraumbilical position. This is just showing the intraoperative photos where basically I've done a bilateral component separation, underlay, and full closure in the midline. Here she is 2 weeks post-op with an intact repair. And here she is at varying time points, 4, 10, 14, and 17 months post-op with no evidence clinically of a hernia recurrence or a bulge. Her belly is strong. She tells me she's engaged in all the physical activities she needs to be engaged in. We also have CT evidence, and I've chosen a couple of different sections from each time point. The reason I show these is because I didn't particularly measure the mesh width very well when I did this case initially, and so when I closed the myofascium in the midline, I got this bulge, or this little wrinkle right here, but that's okay because it helps me to follow something over time. And so what I like to see on these images is that I can see the presence of the device that I'm now going to call tissue, formerly known as surgiment. You can see it here. It's relatively brightly lit, which I'd like to think means it's well vascularized based on all the other rat data and everything I have that suggests that it is. But you can still see it well past a year, and it's thinned, it's remodeled, but it's still giving integrity to the repair, and we know that clinically.